Panic is rippling through the global stock markets as nerves over the coronavirus send shares tumbling. Here in London, the FTSE 100 plummeted 8% in early trading to its lowest level in 3 years. And this comes after big falls in Asia, with Japan's Nikkei index down 5% and Australia's markets down by 7%. Now, compounding these losses are fears of an oil price war, which saw crude collapse at one point by more than 30%. In Italy, the death toll from the virus has soared, leaping 133 in a day to 366. The country now has the highest number of cases outside China. And Saudi Arabia has just started to impose travel restrictions within the country, quarantining the city of Al-Khatif, and has announced it will impose fines of more than $130,000 on anyone who does not correctly declare their health status when they come into the country. There is one glimmer of hope, though, in this battle against the virus. The Chinese province of Hubei has had no new cases outside the city of Wuhan for the second day running. So let's take you live to Beijing and speak to our correspondent, Stephen McDonald. Steve, proof then that these draconian measures implemented in China work.
Yeah, we have sort of two very different pictures here, if you like. We've got the global panic on stock markets, with people talking about an international recession following the coronavirus spreading here, there and everywhere. And on the other hand, we have a situation in China where, well, the emergency does seem to be plateauing if official figures are anything to go by. Now, I know some people will say those figures can't be relied on, they can't possibly catch all the cases. But nevertheless, let's assume in trend terms they're instructive. And what it would seem to suggest is that the problem has gone like this in Wuhan and is now coming down. And you look at the picture in the rest of the China, it's even more optimistic. I mean, if you take that one city of Wuhan out of the picture, and also people who are arriving in China from overseas, bringing the coronavirus with them, for the last 4 days in a row, we've had 0 extra coronavirus infections. Now, that would seem to suggest that that these measures being put in place in China, quite strict measures restricting people's movements, are working. Also, you know, you look at South Korea, the situation for the moment does seem to be also plateauing there. Now, people in other countries might take some hope from this, but that doesn't help them in the short term, because elsewhere, you know, as the coronavirus hits economy after economy, there is going to be some pain. And when you look at the markets, you know, I think the difference is those who are gambling, which is what it's all about, on the short term versus the long term. People can see there is going to be short term pain, although eventually, you know, this problem will be sorted out.
Steve, thanks so much for joining us. Steve McDonald there live for us in Beijing. Well, let's update you now on what is happening in Italy, because the government has said it will increase spending to offset the economic impact of the coronavirus and what the Prime Minister has described as shock therapy. That's after the death toll from the virus shot up by 133 on Sunday. The total number of infections has also increased dramatically. Strict measures have been introduced to reduce social interaction, especially in the northern regions, which are the worst affected areas. For more on those measures, I've been speaking to our correspondent Bethany Bell. She is in Bologna, which is just outside the affected area.
We're getting a few more details as to exactly what this partial lockdown means. We're told that people are not allowed to leave Lombardy or to enter Lombardy unless they have very important, essential work-related reasons for doing so, or emergency family reasons. And people will be checked if they try to leave airports or train stations and asked to give their justification for their movements. People also have been encouraged to stay where they are within those regions to try and prevent the spread of the disease. Now, also we've seen lockdowns, as we heard, in Venice. People here are getting very concerned about this on the impact of the economy and the the actual governor of Veneto, where Venice is, has actually said that he believes that Venice, Padua and Treviso should not be part of these restrictions, which he said were disproportionate. But other people here say, no, Italy is facing a national emergency. Maybe the government has been far too slow in imposing these kind of strict measures, but we're waiting to see just how firmly and strictly the authorities will actually try and police these.
Bethany, you're in Bologna, but we have some live pictures coming to us of the place you were last week, right outside the Duomo, the cathedral in Milan. Empty streets there, so you can see as well the impact on daily life and the economy in a big city like Milan. But what about the healthcare system? What concerns are people expressing today about whether or not it will be able to cope?
Well, the hospitals at the centre of this outbreak so far say they're really struggling, and this is in Italy's developed north. People have said that there are, in certain hospitals, they're having to set up intensive care units in corridors, and the fear is if this virus spreads to southern regions where the healthcare system is perhaps not so good, then this could be a really, really difficult situation for the country as a whole. And really, this is, I think, what is really spooking people. I spoke to a couple of people yesterday and they were saying that inside the zone in Piacenza, and they were saying that you hear the sound of ambulances all the time. It's really worrying people here.
Well, to the cruise liner, which has been quarantined off the coast of California since an outbreak of coronavirus on board last Wednesday. It is due to dock at Oakland near San Francisco. The passengers are expected to begin disembarking shortly, with the sickest being allowed off first. Sophie Long is in San Francisco for us.
Well, in what the governor of California called an enormously complex operation, we now know that the Grand Princess cruise liner will dock at Oakland Port at some point on Monday. Now, that's the port just across the water there. I'm on the San Francisco side. It is a commercial but non-passenger port. He couldn't give an exact time. He said that was dependent on cross currents and tides, but he is confident that that will happen at some point on Monday. Then the disembarkment process will begin. The first people to be taken off the ship will be those in acute need of hospitalisation. The next priority will be Californians. There are about 1,000 people from California on board that ship. They will be the next off, and they will be taken to a facility, a military facility within the state for isolation and monitoring. The next off will be other US citizens who aren't from California. They will be taken to Oakland Airport and taken on to facilities either in Texas or Georgia. Now, the last people to be taken off that boat, we believe, could be the international passengers. Among them, 142 Britons. We are told that they will be taken to Oakland Airport, where they will be repatriated to their own countries. Now, we've heard from the Foreign Office in London. They say they're working very closely with the authorities here to arrange a flight to take those 142 Britons back to the UK. We don't yet know where they will go after that or how long that process will take. This whole operation of disembarkment could take several days, so Brits could be on there for another few days. They don't yet know when they'll be able to get off that boat. So for the passengers, though, more than 2,500 of those, around 2,500, the end could be in sight. They will be off that ship at some point in the near future. A different story to the more than 1,100 crew, though. They will be treated and quarantined on the ship, and that ship will not be allowed to remain alongside in Oakland.